So I bring in all the wishes and greetings to Dr. Shriyash Sinha for scoring rank number 4 in MCH head and neck surgery in ini-cet session April 2023. Congratulations to you, Doctor.
Thank you so much, sir.
Now, can we know something about Dr. Shriyash from where he started his career till date?
Sir, I did my MBBS from the Armed Forces Medical College, Pune. Subsequently, I did my MS in ENT from Calcutta National Medical College. I passed out in July 2022, and so subsequently I was serving my the West Bengal State bond, and I think in February earlier this year I wrote the National Board Fellowship Entrance Test for Head and Neck Oncology, and I secured rank 1 in that. So for the past couple of months, I've been doing my fellowship in Head and Neck Oncology for Rajiv Gandhi Cancer Institute in New Delhi.
Great, Doctor. And why the idea of super specialty in MCH head and neck surgery, oncology?
Sir, I've always been fascinated with oncology. I think during my MBBS days, I remember reading a book called The Emperor of All Maladies by Siddharth Mukherjee. And subsequently, during my MS days, I was lucky enough to have a little bit of exposure to head and neck. My HOD there, Dr. Somnath Sasa, used to single-handedly do a lot of head and neck cases. So I think a lot of the fascination came from there.
Okay. Now, once you have decided to do so, how you started with preparation? When did you start? How much of time dedicated for this?
Yes, sir. I actually, once I realized that I had an inclination, I tried finding out as much as possible about the exam. And so very few, I mean, there are barely any MCQ books or such resources available. So I stumbled upon Speed Institute. It's still the only institute which offers a specific course in head and neck. So I started my preparation probably around a little late. I took a gap. I took a little bit of a break after my MS exam. Probably November 2022 is when I properly started studying for head and neck. Mostly I relied on the Speed app. Dr. Teja sir's videos were extremely concise and absolutely to the point. And he sort of showed the way as to how to go about preparing.
Great, Doctor. Now, your message, what is the message that you want to give to the aspirants of MCH head and neck surgery from an ENT background?
So I think like the problem with head and neck surgery is that there are a very few seats that are there. So often it feels like often the session seems insurmountable. But I think probably the only thing that I'd like to suggest to aspirants is to continue working hard, concentrate on things which are within their control, and just continue persevering.
Can you little bit brief on, because MS ENT, now the NEET exam is there, INI exam is there. Now, what was your primary exam? Is it a NEET exam or an INI-cet exam? Where you trained for both?
I was targeting the INI exam. I personally felt that I had better chances in the INI exam. The NEET exam has now shifted from being a head and neck based exam to being an ENT exam. That I felt was more vast. The problem with the INI exam was that general surgery was being quizzed. But I still felt like it was easier preparing for the INI exam as opposed to the NEET exam.
Okay. How many questions were you able to attend?
Sir, I had watched a video prior to the exam and where you had suggested to go all out and attempt maximum number of questions. Sir, I think I attempted around 76 questions.
Okay. Very good. You're about to say something?
No, sir, I was saying like the questions that I did leave, they were all surgery questions and I didn't even feel apologetic about leaving them because I had absolutely no idea.
Okay. Now, the time to thank and whom all you want to thank who have made this question for you.
Sir, firstly, I'd like to thank my parents. I think successes and failures aside, just being their son has been the biggest blessing in my life. Apart from that, my grandparents, I'm not very religious, but they always pray for me. And I'd like to thank my sister, sir. She's from your college. After having done undergraduation from Madras Medical College, she's now pursuing general surgery. She's at Mahatma Gandhi Medical College, Indore.
So I wish you all the very best and all the success for a great career in head and neck surgery and oncology, and
Uh,
surgeon in the
Thank
making.
you so much, sir. So I'd please pass on my gratitude to Teja, sir. I think I
Sure.
attribute my success in the not only in the MCH exam but as well as in the fellowship entrance test to him. I think he really his classes were really helpful, and it sort of guided me in how to go about preparing for such an exam.
Sure, I'll convey him and also pass on this video to him, and he'll be happy to hear the nice words that you have given to him. Definitely, he will feel very happy, and I'll convey him also.
Thank you so much, sir.
Best wishes to you, doctor.